Good afternoon. My name is Denis Juraga, and I'm an assistant PhD student at the Department for Social Medicine and Epidemiology at the Faculty of Medicine, University of Rijeka. So today I will present to you the SEFAC project and in its implementation in 4 European cities. Before I talk about the SEFAC project, I want you introduce some facts that are related to the major two chronic diseases, chronic conditions that are in the focus of the SEFAC project. Those are cardiovascular diseases and type 2 diabetes mellitus. So some facts about cardiovascular diseases. So they are the most common non-communicable diseases globally. They were responsible for 17.8 million deaths in 2017. And if we control and modify the risk factors such as unhealthy diet, physical inactivity, tobacco use, excessive alcohol consumption, high blood pressure, etc., we can have 80% less premature deaths globally. On the other hand, there is type 2 diabetes that caused approximately 4 million deaths in 2017. Total diabetes-related health expenditures in Europe in 2019 were 161.4 billion USD dollars, and the prevalence of type 2 diabetes global was 415 million, and it is estimated that 642 million people will have type 2 diabetes in 2040. So to overcome that challenge, the SEFAC project was developed. So its focus is taking control of your own health, and it is based on adopting healthy lifestyle habits, development of positive attitudes towards health, and chronic disease self-management. So to test this new approach, 4 pilot sites were established in 4 European regions. The 4 pilot sites are Cornwall from UK, then Rijeka from Croatia, Rotterdam from the Netherlands, and Treviso from Italy. Before the implementation phase started, every pilot site established a stakeholder alliance. The different stakeholders can make a connection within the city and to support the participants during the implementation phase. So healthcare professionals, volunteers, patronage nurses were included in that stakeholders alliance, as well as the participants as themselves. So every pilot site included 90 participants, total 360, who are 50 years and older. And within that 90 participants, we divided them in 3 groups. So the first group was participants that are at risk of developing major chronic diseases. Second group is participants that have a particular cardiovascular disease. And the third, participants that have type 2 diabetes mellitus. The implementation phase was based on 3 tools: the mindfulness-based workshops, the social engagement, and the SEFAC mobile application. So the mindfulness-based workshops were developed. The program was developed by ISRA, is the institute from Treviso, Italy. The program lasted for 7 weeks, and every week we had 1 workshop that lasted for 2.5 hours. And here are written the themes that we presented to the participants. There were healthy habits, healthy mindset, healthy eating, and etc. So the other tool was the social engagement, the volunteers. That this approach is based on the NUKI Pathfinder program from UK, and the precise role dependent on every pilot site in context of geographical, cultural, and social approach. And the third, not the least, tool was the SEFAC mobile application that supported the participants in changing their lifestyle. It was made from the Vidavo, from Greece, and it was for the participants were invited to download it before at the first workshop and to use it for 6 months. So here's a brief figure how the implementation phase was conducted in each pilot site. So we started with the workshops, and 6 months after we had a follow-up evaluation questionnaire. So using the learnings of this project, a SEFA toolbox will be developed so you can implement this approach in every European region in regard to the geographical, cultural, and social context. So at the end, I want to ask you, which side do you choose? Do you choose the mindful side, or do you choose the mindful side? If you have some questions, feel free to ask me after this session. You can send me an email. My email is at the bottom of this slide. Thank you very much for your attention.